much for agreeing to talk to me today.
Pleasure.
Obviously, you and I have known one another some time as a public partner in the School of Public Health Research. And I know you've been involved for a long time in the Applied Research Collaboration, and before that, the Clerk for the North West Coast. So I know you have a special interest in the health inequalities field. So perhaps you could just tell us why you've taken such an interest in being involved in that area.
There are two reasons, I think. Chronologically, the first one was back in the 1970s, and I worked for Darlington Borough Council. Now, I don't know if you know Darlington at all, but it has a railway line that runs from London to Scotland, goes right through the middle of the town. And on the right-hand side of the town, the east side of the town, is all the cheap houses, all the 2 up and 2 down, Victorian terraces and so on and so forth. On the left-hand side of the town, the west side, it's all lovely semis and detached with lovely gardens and so on and so forth. And I remember asking my boss at the time, why is that? Why is it split between east and west? And he said, well, it's obvious if you think about it, because back in Victorian times, all the industry was built in the middle along the railway line and the river as well. So the gas works would have been there. Yeah. So everybody who could afford it would live in the west side of town because that's where the wind came from. So they were getting fresh air. You know, they were getting nice clean air from the southwest. The poor people had no choice but to live on the east side of town where they were getting all the mucky air. So that was my first time that I really thought about it. Not so much in terms of health inequalities, but in terms of the right side of the tracks, if you will. Yeah. You know, and so on. Later on, I was a trustee of Royal Mencap Society, the National Mencap, because I have a son with a severe learning disability and autism and other things. And I was a trustee at the time. They did a campaign called Death by Indifference, which was about 6 people with a learning disability who died in hospital due to the indifference of the staff of those particular hospitals. The person who actually, it's a phenomenal campaign. The person who actually ran it got an OBE for doing it, which well deserved. And that made me really start thinking about learning disability, about health inequalities. And I guess since then, having a son, as I do, I've become, I wouldn't say obsessed, but it's been not far away from obsessed, I guess, but it's a very important part of my life. And I don't know if you know the LEADER project, but it used LEDER, and it used to be Bristol University, but now it's one of the London universities in partnership with UCLan. But the final report from Bristol University, they said that on average, a person with a severe learning disability dies 25 years younger than everybody else. 25.
Shocking.
That's
shocking.
Massive, isn't it?
So from that perspective, we're developing new program around health inequalities. I just wondered if you would fairly briefly give us just a couple of what you would consider should be the priorities for a program like that. I mean, you know, we've got a broad outline around looking at the levelling up agenda and recovery from COVID, but within that context, what you think the priorities should be?
I think one of them's got to be communities, and it's got to be living in a healthy environment. Yeah. And going back to that Darlington and St Helens, where I live now, is exactly the same. The west side of town. I was talking to somebody at the CCG, and he said on average, I think their life expectancy is 8 years longer than the people on the east side of town, which is phenomenal, isn't it? I know it, just because you live on the right side of the tracks. So I think communities is important. I'm not going to pretend that I know how you deal with that, because it's really complicated, but I think it has to be a real priority, and where you live has got to be made healthier somehow. As well as that, and it's difficult because it's going to sound like I'm blaming people, and I'm not, but there tends to be a healthier way of life if you've got a little bit more money and than the people who don't. Now, I don't really understand why that is, but again, it appears to be the case. So if that can be done, Jenny, don't you know, this stuff, I'm interested in all this stuff, but please, I'm not an expert, so don't
Yeah, absolutely.
don't think I am.
Yeah.
But there are certain things, aren't there, that sort of stick out like that you think, yes, that needs looking into, and the sort of research. You know, why is it that people with less money tend to eat less healthy food than people with a few quid more in their pockets? Why? I don't know.
Okay.
Do they smoke more? I don't know, but I wouldn't be surprised. Do they drink more? I don't know, but I wouldn't be surprised. Do you know what I mean? Those sort of questions.
Yeah. So before we've finished, we haven't got very much time, and you haven't. You mentioned when we were talking earlier about, you know, that you didn't think a focus on just social determinants was enough.
Yeah.
I just wondered if you could very, very briefly elaborate on that a little.
It's kind of the difference between health equality and health equity. You can, I think you can get health equality just by looking at social determinants. Yeah. But in order to, I mean, we always talk about in the learning disability world about the reasonable adjustments. Yeah. And all you've got to do is make reasonable adjustments for people like my son, and then you can achieve health equity. That's the way I look at it. Because, you know, I think, but having said that, you've got to try and achieve health equality before you get anywhere near health equity, I believe. So what you're tackle the big issues first.
Yeah. So what you're talking about is the need to look at different dimensions of inequality, aren't you? Whether it's disability or other dimensions like racism and that kind of idea, really.
Yeah. As I say, in my case, it's more the people with disabilities who, you know, it's not a social determinant. Nobody determined that my son has a learning disability. It's just an unfortunate thing that happened when he was born, and unfortunately, you know, I mentioned the death by indifference thing. I mean, unfortunately, there's still evidence that even today there are people in the NHS and probably people around who think that the quality of life of somebody with a severe learning disability isn't worth spending the money on. And that's really, really sad.
Yeah. Okay. Alan, that's been brilliant. Thank you very much for sharing your wisdom with us. It's always great conversations with you, and I've looked forward to working with you on the School for Public Health's research in the future.
And me too, with you.